Hi, I'm Dr. Duffey. I'm a psychiatrist at the Georgia College Counseling Center. If you or your child have attention deficit hyperactivity disorder, holding false ideas about it can be disastrous. It could lead to lives of missed opportunity. This is the first of two videos about common misconceptions about ADHD. I would guess that the public's picture of a person with ADHD is a young person who seems to be constantly moving around in their seat in class, tapping on something or moving their legs. The public's picture is an example of hyperactivity, but many people with ADHD don't have hyperactivity. A parent might logically think that because their child doesn't have hyperactivity, that they don't have ADHD. There is a subtype, however, of ADHD called ADHD primarily inattentive. People with this subtype are not restless and can sit in their seats. Their inattention can go unnoticed. So a student doesn't have to have hyperactivity to have ADHD, even though hyperactivity is in the name. Also, a student doesn't have to make bad grades or be a poor student to have ADHD. Many students with ADHD are intelligent and may have superior intelligence. They may even take advanced placement courses in high school. Students with ADHD can think, understand, and reason. They may have a good fund of knowledge. High school teachers usually taught the content of the textbook in class. Students were spared having to read the textbook. In college, teachers expect students to read the textbook on their own, and they lecture about additional things in class. Another reason students with ADHD may not have bad grades is that they spend more time studying than other students. Their study is unproductive and takes longer, but they're willing to put in the extra hours. Until college, they could keep up with the pace of school by putting in the extra time. In the process of doing this, they have developed the courage and grit to do something hard for themselves and to sacrifice time with friends and other interests to earn parental respect and to keep up with their peers academically. People may think that if a student doesn't have all the symptoms, they don't have ADHD. They're all degrees of severity of ADHD. The diagnosis requires that they have several, but not all, of the possible symptoms. One misconception is that if a person is having problems with academics, then they must have ADHD. Several things can affect a person's academic abilities. Persistently not getting enough sleep has a significant effect on memory and concentration. Believing that they need to study each week only as much as they did in high school is another factor in poor academic performance in college. The effect of physical and mental illnesses, as well as the abuse of marijuana, alcohol, and other drugs, can impair the brain's ability to function. Sometimes they can co-occur with ADHD as well. We call them comorbid. It's not uncommon to see comorbid generalized anxiety and depression of different types. Sometimes learning disabilities and problems with processing speed can be mistaken for ADHD. A few students who start with ADHD as children and become depressed in early adolescence show signs of hypomania in their 20s and then require treatment for bipolar disorder. Another misconception about ADHD is that it only affects students academically. People with ADHD have it 24 hours a day, 7 days a week. For example, sometimes the hyperactivity translates into being a restless sleeper who moves around in the bed more than most people. Bed partners may complain that they get kicked or their covers stolen. The messenger chemical dopamine does several things in the brain, and one of them is to reduce unnecessary movement. People with ADHD and people with restless leg syndrome both have problems with their dopamine systems. The difficulties with paying attention to the teacher in the classroom continue as difficulty paying attention to friends who are talking to them. Their friends or their parents ask, "Are you paying attention to me?" Parents have learned they can't assign the student 4 things to do, but instead give them one at a time and tell them to come back when they're done, and the parent will give them another. Having ADHD is sort of like having a car engine that's stuck in the high idle position and is raring to go. This kind of inner restlessness can lead to impulsively blurting out things or interrupting others who are talking. The student with ADHD has a kind of urgency that feels that it makes it difficult for them to wait. Waiting in lines is frustrating. Waiting for the other person to finish talking so they can speak is hard for them. Even though they may get through social situations and occasions, they may not feel comfortable or masterful in them because of their attentional difficulties. You see, every person there has a name to remember. Every person's talking to them, and their mind is wandering and they're forgetting what was said. There's just too much data to process, and the environment is also distracted with lots of things going on in the background. So overall, they may feel a little intimidated and awkward. Another misconception about people with ADHD is that they're lazy. Several things go into the appearance of laziness. Studying when a student has ADHD is much harder and more frustrating than it is for other people. This is only one of the factors in students with ADHD not studying, however. The other has to do with the dopamine system again. People with Parkinson's disease, for example, lack enough cells that make dopamine. Now, 2 of the symptoms of Parkinson's disease are difficulty initiating a movement, like getting out of chairs, and difficulty in initiating conversation. In other words, the process of getting started. The student with ADHD has difficulty getting started studying and so procrastinates. Dopamine is also involved in the ability to enjoy things, and studying is not as reinforcing because it's not as enjoyable. So studying is both less enjoyable and less reinforcing. So that leads to the student possibly giving up in frustration, because when they finally sit down, they get restless and they have to get up, and then they find their mind wandering. So it's very difficult to complete tasks sometimes. Some students with ADHD use daily organizers, multiple lists, calendars, and lots of sticky notes. Their rooms are very well organized, and they have things lined up in their bathroom in a certain order. The items that they need are placed in front of their door each night. They have multiple alarms on their phone. All this makes them look like they're obsessive compulsive, but actually they're working hard to compensate for being disorganized and forgetful. Organizing their desk is something to do when procrastinating, and it removes potential distractions. Please continue with part 2 of the video. Thank you.